So, doctor, what are the some unexpected foods that triggers allergies?
So it's very interesting because when we look at food allergies, any reaction that a person has to a food is unexpected, right? They don't know. They may have eaten that food for a few years, for a few decades of their life, and then one fine day they have a reaction to it. So to me, every food allergy technically for that person is unexpected. Even when a baby gets an allergy to milk, the parents are not expecting it. But when we look at unusual foods, there are examples of things like drumstick, which is so common, or something like cinnamon, or something like cloves. I've even had people who get react to the red dye, which is used in food, in drinks, in textiles, and these red dyes are derived from an insect called cochineal bugs, and it's called carmine red. So we've had people have allergies to these things, and sometimes even anaphylaxis, which is a severe allergy. So any food, there are more than 170 known foods that can give food allergies, and the list is very long of what can give a reaction.
Okay. So, what's the difference between allergies and intolerance?
So when we talk about food allergies, we are specifically talking about a reaction mediated by an antibody that we all have in our body called IgE, E for elephant. Now, this IgE antibody, when it binds to certain foods that the person is sensitized to, it gives reaction within minutes and maximum within a few hours. So a food allergy is a more acute reaction, and it can manifest in a variety of different symptoms of the skin, of the respiratory tract, of the stomach and the digestive system, the cardiovascular system. Many things can get affected. When we talk of food intolerance, we're talking about a more slow or delayed reaction in many cases, because there the antibody involved is IgG, okay? G for goat. So this IgG antibody creates immune complexes and gives symptoms like bloating, indigestion, gas, nausea, diarrhea, body ache, headaches. So the symptoms are more diffuse. They tend to occur several hours to maybe even a day or two later. So food intolerance is a different problem, and amongst intolerance, and even chemical sensitivities come. So if someone has caffeine and they get a headache and a fast heart rate and they start sweating, which is an unusual reaction, it's an intolerance. Or someone has lactose and they start having indigestion, bloating, gas, diarrhea, that's also an intolerance. That's not a milk allergy, it's a milk lactose intolerance. So that's the difference between these two.
And what are the symptoms, diagnosis, and treatment for food allergies?
So food allergy manifestations or symptoms, when we look at it, it can begin from having itching. It can have hives, which are red raised rashes. The person can have swelling when they're having a food allergy, which can come on the eyelids, face, lips, ears, any part of the body. And in severe allergy, it can be all over. The hives come like mosquito bites, and they get much bigger and larger, called wheals and urticarial lesions. You can also have sneezing, runny nose. You can have coughing, wheezing, shortness of breath, change in voice, hoarse voice, because the air tube, the larynx, the airway is getting swollen. And beyond that, you can have low blood pressure, dizziness, fainting, even loss of consciousness. You can have nausea, vomiting. And ultimately, all of this can lead to something called anaphylactic shock, where a person can lose their life because of a very severe food allergic reaction. So the manifestations are myriad. Not everyone has everything. Different people have different combination of these symptoms. So you require a very high level of suspicion to be able to narrow it down and then evaluate it further. And in general, when we talk about diagnosis, we are talking about doing allergy skin testing. We are doing something called specific IgE testing on blood, which is done through various systems like Immunocap or something called CRD, component resolved diagnostics. And then the initial plan is avoidance of the foods, because that's the primary way in which you can protect a person or an individual. And later on, there are ways that we can work on following these allergies and considering whether a person is outgrowing it, or considering desensitization in very, very selected cases.
Does allergies reaction that cause anaphylaxis? Please elaborate about it. What is it? How severe it is? And what should be done in it?
So, anaphylaxis is a severe allergic reaction where a person generally has more than one system of the body involved in the food reaction. So, they may start off with itchy rashes, hives, swelling, and then they may start having wheezing, coughing, breathlessness, which means now the skin system and the breathing system both are involved. And in anaphylaxis, generally, you have two systems involved. More can be involved. You can get nausea, vomiting, diarrhea, which means the reaction is going above and beyond just giving itching and rashes. So when it internalizes the reaction, that's called anaphylaxis. That becomes serious. If it goes to the cardiovascular system, your heart and your circulation, then you can get low blood pressure, you can get dizziness, you can faint, you can feel like there's a blackout happening, and you can actually lose consciousness. And then, due to either a very low blood pressure or due to closing off of the airway due to swelling, the air passage due to swelling, you can actually, someone can lose their life. And there have been many deaths associated with food allergy anaphylaxis. So it's a very severe reaction. Now, previously we used to think two systems have to be involved, but now we know that even if one system is severely involved, some people after eating the food can directly have a drop in blood pressure, faint, and lose their consciousness. Others can just have the food and all they'll have is breathing difficulty, bronchospasm, laryngospasm, and have a lot of trouble. They won't have any hives, they won't have any itching. So, this is a very important thing about anaphylaxis. And again, the most important thing in this is the right diagnosis. And in generally, a severe anaphylaxis, we don't do skin testing. We prefer to do blood testing. In the milder, questionable forms, we might do a allergy skin testing. But eventually, the right diagnosis, the avoidance measures, the right action plan is very key that an allergist, immunologist can define and give the individual.
Thus, thus allergic reaction can cause anaphylaxis. Please elaborate about it. What is it? How severe it is, and what should be done?
When someone has an anaphylactic reaction, it is very important that it be recognized at the earliest time point. And with that recognition, the first and primary, what I would call gold standard drug that needs to be administered is adrenaline or epinephrine, because this is life saving in severe food allergies. This relieves the bronchospasm in the airways, opens the air tube, raises the blood pressure, has multiple mechanisms by which it buys time, so the person can then be taken or can go to an emergency room or hospital for further management. So the first line of management of anaphylaxis is epinephrine and adrenaline. After that come the antihistamines, which are most commonly used. After that comes the steroids, which are very commonly used. Also, along with this, if there is access that the patient or the family has, using a nebulizer or an inhaler, if it has caused bronchospasm, can be immensely beneficial. And if they're in the hospital setting, then use of oxygen, use of nebulized medications to open the airways, and use of IV fluids can make a world of difference and save lives in anaphylaxis. So the management of anaphylaxis follows the same principle: ABC, airway, breathing, circulation. You stabilize that and then you treat the other symptoms.
So, doctor, what are the relates of multiple food allergies and how severe it could be?
So, when we talk about multiple food allergies, there's an interesting thing that there are studies done where, general population surveys have been done to ask people, do you think you have food allergy? And, up to 20-25% people will say they have a food allergy. But in reality, it's not an allergy, it's usually an intolerance, which is generally not life threatening. It is life altering, but not life threatening. So, when we talk about real food allergies, we have to really think about, is it truly causing the symptoms that I mentioned? So always there's something called a food challenge or a food elimination and reintroduction that is done only after a very careful history has been taken. So if someone goes out and does a blood test for 50, 100, 200 foods and they come back positive to 10 or 12 things, you can be sure that 10 or 12 things are not allergic. Out of them, maybe 3 or 4 at the most, max 5 would be a real allergy. The rest would be what we call cross reactivities or false positives. And this is very important. So it's the job of an allergist, immunologist to actually take a very careful history after doing the allergy testing, the skin test or the blood test, and go back and correlate it with the person's history. Are they eating it? Are they not eating it? Do they have symptoms after eating it? Are the symptoms only sometimes or all the time? All this will tell us if it's a real food allergy or it's only a sensitization. Sensitization means the test is positive, but symptoms don't exist. So most people with multiple food allergies actually don't have multiple food allergies. Those who do have multiple food allergies, the causes can be many, right from genetics. If you're born with a family history of allergies, your risk is higher. If you have had a very westernized diet and lifestyle, it increases your risk of allergies. If you have eczema, which is atopic dermatitis, a damaged skin barrier through which many foods can enter and cause, such people can have IgE levels, the allergic antibody levels, in thousands, and they can also have multiple positives on a skin test or blood test. But we really have to carefully correlate, is it really relevant to that person or it's only a positive test? So these multiple food allergies require careful history, investigation, rehistory after the investigation, and then elimination or avoidance, and then a lot of diet lifestyle changes, which we recommend. And we have teams of diet counselors to do that.
Is immunotherapy the only hope for multiple food allergies?
So, multiple food allergies are not treated by immunotherapy generally. Immunotherapy is done for selectively. So, when we are talking about food oral immunotherapy or food oral desensitization, we are taking only the severe food allergies. And in these severe food allergies, it's generally some degree of anaphylaxis that we are talking about. And in these situations, we have to again be very careful to make the patient or their family understand that there are risks involved with doing a food immunotherapy or food allergen immunotherapy, because a person can get anaphylaxis while doing it. Now, eliminating the food, improving diet, lifestyle, managing if they have coexistent asthma and other allergies makes a big difference to sometimes how bad the food allergy may be affecting the person. And more recently, a very interesting thing has happened where in the US, a drug called omalizumab, which is an anti-IgE molecule, has been approved for people with multiple confirmed severe food allergies, where it is used to reduce the threshold at which they will react. So if someone just licks a peanut and gets a full-blown anaphylaxis, the possibility is if they are on omalizumab or anti-IgE injections, they may accidentally, if they get exposed to one or two peanuts in some food that they didn't realize, though they were careful, they won't lose their life or get a severe reaction due to it. But it is not a cure for severe food allergies. It's a supportive treatment, and ultimately, with an allergist immunologist, food immunotherapy or food desensitization for those allergies is the only hope, and that's the primary way of managing it.